Welcome back to Power Lunch, everybody. CNBC's 12th annual Disruptor 50 list is out today. And of course, a key trend across this year's list is artificial intelligence. To see the full list, you can scan the QR code on your screen or go to cnbc.com/disruptors. But among the list, we saw an increase in the number of healthcare and biotech startups, one of which is driven by the healthcare provider Cityblock, making a return from last year's list, but declining in the rankings slightly because of some layoffs last year. For more on the company, let's go to our own Julia Boorstin, and with her is Cityblock co-founder and CEO Dr. Toyin Ajayi in Brooklyn.
Thanks so much, Tyler. That's right. I'm joined now by Dr. Toyin Ajayi, CEO and co-founder of Cityblock Health. Thank you so much for joining us here in your offices. I know you have a big meeting of some of your leaders from across a 1,000-employee organization today. Talk to us a little bit about your model of integrated primary care, a community-based model. You integrate a couple of different things that aren't traditionally associated with medical care, such as behavioral health and social services. Why does your model work to reduce costs for Medicare and Medicaid patients?
First of all, thank you so much, Julia. It's so nice to be with you, and such an honor to be on the list. So just all our gratitude. We're really, really delighted. So what Cityblock does, which is unique in the healthcare space, is first of all, we focus on people with the most complex needs, people who are likely to struggle to address their needs through the traditional healthcare system. We focus on people who get their insurance through Medicaid, which means they're low income, and people who are dually eligible for Medicare and Medicaid, primarily seniors living in poverty and younger people with disabilities. And what we know, and I think we all sort of intuitively know this, but it shows up in the data in healthcare so compellingly, is that your diagnoses, your organs, your heart, your lungs, your kidney, your brain, how they're working, is only a small part of what it actually means to be healthy. What drives health for us is our emotional well-being, our psychiatric well-being, our community and our surroundings. For many of our members, it's whether or not you have enough food to eat today, whether you're worried about getting access to education, to transportation to get to your doctor's office. All of that matters so much when we're trying to get people healthy and keep them healthy. And so we focus on all of those.
And so talk to us about your relationship with insurers. You just announced a deal with Centene. You're reaching more of their patients. But what does this mean for you financially? You're trying to achieve profitability. How are you doing in terms of top and bottom line growth?
Yeah, so we're doing great. I think when we first started this company about 6 years ago, lots of questions about whether there's a market in Medicaid, whether you can scale and create profitable margins in Medicaid. And I think we're here to say it is possible to do both of those things. You talked about our partnership with Centene. They're one of the largest health insurers in the country, focused on the Medicaid population. We have a mission alignment for sure, and that's allowed us to grow with them and with other payers. Our relationship is such that we partner with health plans that have an incentive to provide coverage and access and high-quality services to people that they insure across the country. We work with them to identify their highest risk and rising risk population, so the subset of the population that needs more services than most doctors' offices can provide. And then we contract to essentially say, look, if we provide better care to these folks in the community, we take care of their mental needs and their social needs, we can reduce the amount of time they go to the hospital and emergency room, and we create margin for the business.
And so we are out of time, and I'm sorry we don't get more time to hear about your business, but can you just tell me, you mentioned off camera what your revenues were last year and whether you were on a path to profitability. Just tell us how big your business is.
Sure.
Right now.
We closed $1 billion of revenue last year, and we are making great progress on our path to profitability, and we're really excited about it.
And your goal is to reach 10 million members by 2023. By 2030. Sounds like you're well on your way. Toyin Ajayi, CEO and co-founder of Cityblock Health. Thank you so much for having us in your offices here today.
Thank you, Julia. This is great.